Well, welcome back. One of our favorite guests and favorite dentists is back with us today to talk about the Treats for Troops program through Operation Gratitude. Plus, we're going to talk about the scary tooth and truth about sour candy. And we welcome Dr. Marcy Guthrie back to our live show. Dr. Guthrie, it's always a pleasure.
Thank you for having me.
There's some scary, some horrorness that is associated with sour candy?
Yes. Have you had a warhead?
No.
No, I have not had
a warhead?
A warhead.
Warhead, no.
Warheads are what they called. So there's a lot of sour candies out these days.
Yeah.
And as parents, I think we need to educate ourselves and keep us up to date with what's going on with the candy world out there.
Yeah.
So
they're very colorful, though.
They are colorful, so they definitely appeal to the eyes of the little ones. But we've always talked about the sticky, chewy, crunchy candies and how they're bad for your teeth. But what about the sours? What makes them sour? And it's essentially acid. There's a lot of acid in these candies, and what does acid do to our teeth? So it erodes the enamel.
Do people or parents think, well, it's sour, it's not as sweet, so maybe less sugar, it's going to do less damage?
Possibly. They could possibly think that. So I am here to educate.
You always do. You always do. We also have some recommended candies.
We do have some recommended candies. So I like to go towards the chocolates, specifically dark chocolate or milk chocolate, things that are softer, easier to dissolve in your mouth.
Mm-hmm. Less sticky?
Less sticky, correct.
So you're not pulling out those fillings.
Exactly.
That you pay so much money for.
Correct.
Mm-hmm.
Yes. And then.
So tell us about the sour, the rise in their popularity as well.
The rise in the popularity, I really don't know. I'm not a fan.
Oh, you're not a fan?
I'm not a fan of the sour, so I don't really know what it appeals.
That's
but
what truly is sticky.
There is an appeal. I just want to show there's this candy experiment book that I think is awesome for an educational lessons for your kids, but also to show them. We've got some warheads in here.
Okay, little
and
warheads.
And it shows. Yeah. See how sticky they are?
Yeah, they are. They're sticking to it right to the bottom.
Right.
So basically, that cup is your tooth.
Correct, and this is the acid bubbling. So, you know, the tooth enamel likes to be at about a pH of 5.5, and anything below that, like warheads, can get to a pH and acidity of 1.6, which is essentially close to battery acid.
It's close to battery acid, that level?
Yes.
And over time, you know, in moderate, you might have one, but over time, if you eat these, what is it going to do to your teeth?
Good question. What it does is it can erode the enamel. The enamel is the protective layer of the tooth. It's the strongest substance in the body, and as acid erodes it, it can thin it out, make the teeth more sensitive, more yellow, more prone to decay. So especially with our children, our youth, the enamel is thinner in baby teeth than it is in permanent teeth. So, you know, as parents, we have to teach our children the good habits to lead healthy lives, but also to hopefully start those good oral hygiene habits young and keep them out of the dental chair.
If the enamel is developing in a young child, Marcy, is this something that could cause permanent damage down the road?
Well, it sure can cause permanent damage. It kind of sets the tone for the child's oral health life. You know, cavities are the most common childhood chronic disease in children. It's 100% preventable, so moderation is key, and I really like to educate not only the parents but the children of what's going to happen. If you get cavities at a younger age, you're at a higher risk of getting cavities in your adult permanent teeth, and also a fear can set in. You know, if you experience sedation or the dental drill at a young age, you know, hopefully the experience is good. That's what I try to do, is keep all the experiences positive at a young age.
You know, sometimes that could be scarier than a horror movie itself,
right.
the drill. What is your advice when parents are going out here over the next couple of days and Halloween? Should they go through their child's candy bag before they start eating? And if they do, what else should they look for? Right,
absolutely. So I say sort the candy: sticky, chewy, crunchy, and sours. The sours can actually burn your cheek and tongue because of the acidity there. Moderation, maybe give it as a treat, and then also there's other opportunities. You can do candy experiments, you can do a fun art project, or I pay $1 per pound. We can donate it to the troops and give thanks to our troops overseas. We send that candy, of course, with thank you notes and toothbrush and toothpaste, because we do care about their teeth as well, but it gives an opportunity to give back to our troops, say thanks, and get it out of your house at the same time.
It's $1 a pound, Dr. Guthrie?
$1 a pound that we pay to kids, yeah.
And you send it, and you hit on something earlier in the interview. This is 100% preventable, these cavities?
Cavities are 100% preventable.
So they're not hereditary. That's all because of some of these right here. Mostly.
Correct. Yes, heredity does play a big part. Fluoride in the toothpaste is really important. So brushing and flossing your teeth, do an extra good brush and floss this Halloween after you're having candy. Don't let them keep that bag under their bed or in their room. Hide it, out of sight, out of mind.
You know the tricks.
That's right. Yeah. Yep.
The sticky candy that we have is really bad because that can pull out the fillings and you're just constantly chewing. Could it also pull out maybe some of their teeth as well?
It could if it's a loose baby tooth. I mean, actually, we use something similar to gummies if we're trying to get a crown off, that we can warm up and have the patient bite into it and then open and then actually pull out the crown. So we start seeing a lot of dental emergencies around this time of year that, of course, I try to prevent, but, you know, also the time that it's in the mouth, like these lollipops, holding your mouth for a really long time, lowering the acidity, giving the perfect environment for decay.
I gotta say, I love these though.
Yeah.
They're fantastic. You also brought your agent in today, didn't you?
Did.
Who do we have here?
We have Miss Hannah.
Come on in over, Miss Hannah. Come on over here, girl. Who is this?
This is my daughter Hannah. She's
Hi,
been wanting me.
Hannah. Look at this beautiful smile. Miss Hannah, could you turn around so everybody can see your pretty face right here? Look at that. Are you excited about Halloween? All right, I have to ask, what are you gonna go as? What costume are you gonna wear? You're gonna, of course, Belle.
Yeah.
Have you been working on the costume?
Oh yes, we've been working on the costume.
And what do you like about Belle?
It's a Beauty and the Beast.
The Beauty and the Beast. Well, you are beautiful. Thank you so much, Hannah. It's great to see you. Where can they drop off the candy?
At our office, James River Family Dentistry,
What's the address?
2805 McFray Road.
There we go.
Richmond,
right
Virginia.
here.
We're
All right.
accepting donations from November 1st through the 3rd.
James River Family Dentistry, located right there, McRae Road, is participating in the Treats for Troops program through Operation Gratitude. Wednesday, November 1st through Friday, November 3rd. WTVR.com/VTM is where you can find the link to all the details. Stay tuned. We'll be right back with more Virginia This Morning. Happy Halloween, Hannah.